Welcome to Wildcat Science with Mrs. Haugo. This is Chapter 7, Part 9. We are talking about joints and joint disorders of the skeletal system. So we previously talked about the three less immovable joints, types of synovial joints in the skeletal system. So now let's talk about the next three. So ellipsoid is another name for a condyloid joint. And as you see, we have an egg-shaped condyle fitting into a depression on another bone. Some examples are the radiocarpal joints, where you see you have a depression and an egg-shaped condyle. The metacarpal phalangeal, so looking at our hand, we have the metacarpal, and that it has a joint with the first phalanx, the proximal phalanx, and you have the condyle fitting into a depression. The same thing happens on the foot with the metatarsal forming a condyloid joint with the proximal phalanx. Okay, looking at another type of joints, the saddle joint, where you have a saddle-like bone fitting into a depression. And so the first carpal-metacarpal joint, where you have the metacarpal of the thumb fitting into the trapezium carpal bone. And then the first one we talked about was ball and socket joint, where you have a ball fitting into a socket-like depression, like in your shoulder and your hip joints. Now let's talk a little bit about arthroscopy. If we look at our medical terminology, we have arthro, joints, and then oscopy, which is viewing, so looking into joints. Well, how do we do that? Examination and repair of a joint using a lighted instrument, which is arthroscopy. And then that is your arthroscope, which is a type of endoscope, which is any type of instrument that can see inside is an endoscope. And so obviously an arthroscope is a type of instrument that can see inside of a joint. This is really beneficial instead of traditional surgery because it is much less invasive. Arthroscopy can be used to repair or replace a torn ligament, remove or reshape damaged cartilage, and drain extra fluid. There's a nice picture of it on page 156 in your book. Arthroplasty is actual joint replacement like hip or knee. And fun fact, there's a doctor in Viroqua who's pretty famous for doing arthroplasty. Now we're going to talk about joint disorders. What could possibly go wrong with your joints? A pretty common joint disorder is osteoarthritis. So if we look at our medical terminology, osteo bone, arthro, which is joints, and then itis is inflammation. So that means pain, stiffness, and inflammation in a joint, and this is a degenerative disorder, which means it gets worse over time. Some changes include degeneration of the joint cartilage, new bone growth at the edge of a joint, and thickening of the synovial fluid, and calcification of ligaments. This is caused by the normal wear and tear on joints. Injuries and obesity can make this worse. It usually happens in weight-bearing joints, in the hips, the knees, and then in between the vertebrae. Prevention is exercise, weight management, and good core strength, because using your joints in the correct alignment will really help prevent osteoarthritis. Treatments. Well, what happens if a person already has some osteoarthritis? So gentle exercise is a good management tool, pain medications for the pain, and then weight management if that is needed. Let's contrast osteoarthritis with rheumatoid arthritis. This is an autoimmune disorder, which means your immune system is actually attacking your joints. It can cause some problems: joint swelling inflammation, and overgrowth of the synovial membrane. Also, the articular cartilage is destroyed. The joint will make adhesions, so the joints actually stiffen and eventually become useless. So what could you do to get if you have rheumatoid arthritis? Rest. So when it flares up, you'll want to get rest. Gentle exercise is a great way to help treat it. Pain medications for the pain. And then also medications to suppress your immune system because, as we talked about earlier, the immune system is attacking the joints. And if you notice in the descriptions, there are some similarities and some differences between the osteoarthritis and the rheumatoid arthritis. So let's look at a picture. Okay, looking at these three pictures of rheumatoid arthritis, we have early rheumatoid arthritis that looks normal. And then we have some joint swelling and some adhesions that make the joints stiff. And then in late rheumatoid arthritis, you can see that those adhesions have really made the joint stiff and perhaps even unusable. So that is something that we would want to manage in the early stages before it got bad. A third type of arthritis we're going to talk about is septic arthritis. And this is a painful infection in the joint. So when you have a bacterial infection in the joint. Fact, you should not have bacteria in the joint. It should be a pretty sterile environment. Causes, well, something that broke that joint cavity and allowed and introduced bacteria into it. Surgery can sometimes be a cause of septic arthritis, and also illegal drug use. If there is a needle involved, that can put bacteria, among other things, into your system. Treatment. What would happen if you got septic arthritis? Often the doctors would drain the joint because there's lots of inflammation and swelling, and also the use of antibiotics to cure that bacterial infection. Before we jump into other disorders, talking about prevention, the major prevention would be don't use illegal drugs. So I would like you to look at these other disorders and then be able to tell me about them in class. On page 153, dislocations, sprains, herniated discs, and gout. Okay, let's talk about aging and the skeletal system. What happens to the skeletal system as a person ages? Starting a little bit maybe at age 40, 50, 60, and then 70, 80s on through the rest of your life, this would become an issue. So there's a loss of calcium salts and the protein framework. So what would be the issues when there are fewer calcium salts and fewer proteins? This would make bones weaker, less dense, and more fragile, and falls actually are more likely, leading to more common broken bones that take longer to heal. I would like you to think and also look in your book about, as a person ages, why would they shrink in height? And why would there be more joint damage? So as we're finishing up the chapter, we're going to learn what about Reggie, what happened to him. And our chapter 7 notes are finished. Good job. Thank you.